Hi, I'd like to talk to you today about euthanasia, or physician-assisted suicide, and persuade you that the right to die and choose the way in which you die should remain yours and not that of your governments. This debate has gone on for many years, and it will continue to be a controversial topic for many years to come, no matter the results of any court battles. A person's right to choose the manner of his or her own death in extreme circumstances should be his or her own. There are three main definitions for euthanasia. The first is voluntary, where the act must be in accordance with the wishes of a competent individual. The next is non-voluntary, where it's carried out without the knowledge of the wishes of the patient. For example, the patient is now or always has been incompetent or has left no advance medical directive. And finally, there's involuntary, where it goes against the wishes of a competent individual or against an advance medical directive. Oftentimes, when talking about euthanasia, a mental image of Dr. Kevorkian is thought of, or Dr. Death. Dr. Kevorkian was villainized in the media when his ultimate goal was helping others to as peaceful an ending as possible. Other cases in the media were Terri Schiavo in Florida, and this brought a lot of media attention to this subject. If a person suffers from a terminal illness or has unendurable chronic pain, that person should have the right to choose how to end his or her own life. In a Harris poll, 70% of adults favor a law that allows euthanasia or a physician-assisted suicide for terminally ill patients. While researching euthanasia, I came across several quotes, this one being the most prominent. Neil Gorsuch, Principal Deputy Associate Attorney General for the U.S. Department of Justice, wrote, "Since the New Jersey State Supreme Court decided the first right to refuse case in 1976, virtually every state in the nation has recognized the right of at least competent individuals to refuse even basic life-sustaining medical care, like tubes for food and water. Given the widespread acceptance of such a right, the question follows whether assisted suicide and euthanasia must also be accepted. If patients have a right to tell their doctors to remove respirators and feeding tubes, in fairness, should they also have the right to tell their doctors to administer lethal injections?" These views and others like them have gone on to help develop the first laws for euthanasia. In Oregon, the Die with Dignity law was passed in 1997 and upheld in 2006. Since the law was enacted, 401 patients have died under the terms of the law. In 2008 alone, 88 people requested lethal medications prescribed. Of those 88, 54 took the medication, 22 died of their underlying diseases, and 12 were still alive at the end of 2008. The majority of the patients were white, well-educated, and were more likely to have cancer than any other disease. Outside the United States, there has also been laws put into place. The Netherlands put into place a law in November of 2003 that had very specific guidelines. The request had to come from the patient, it had to be completely voluntary, and well considered and persistent. The patient had to have adequate information about his or her condition, the prognosis, and the alternative treatments, among other criteria. There are those who oppose the laws for assisted suicide as well. A lot of them feel that we are setting forth on a slippery slope, that society will become used to the practice and it will become too commonplace. Examples in the Netherlands and Oregon have proven that those laws can take different situations into account and can work in favor of both the patient and the legal system. Others use religious beliefs for reasoning. The Lutheran Church came out with a statement that opposed suicide and euthanasia. However, their adopted statement, end-of-life decisions, they state that the competent patients may refuse treatment recommended by healthcare professionals. It goes on further to state the physicians and other healthcare professionals have the responsibility to relieve suffering. This seems to be in opposition of their statement. It also goes against the powers of church and separating the powers of church and state. Others feel that the quality of health care will bolster their views. This argument is misleading because many of the drugs that are used have come with severe side effects such as nausea, incontinence, and semi-permanent drowsiness. Furthermore, not everyone wishes to go through this or to put their loved ones through it either. Finally, Webster defines euthanasia from the Greek to mean good or easy death. If we had stronger policies on this issue, it wouldn't have taken 7 years to decide Terry Schiavo's case. In cases which a person has a finite amount of time that they have left to live, and the quality of life is something that will cause them to suffer needlessly, the choice to end that life early is understandable. To make that choice unlawful not only does not help the patient, but it doesn't help the loved ones either. Enacting laws that will guide and regulate the process is the best alternative for all concerned.